I love the community that I work in. They are just so welcoming. My first couple of weeks here, they all knew there was a new doctor in town, and some of them just booked in to come meet me.
Kuiti is in the middle of the Kink country, and it was really a railway town. Prior to that, it was quite a significant Maori settlement. Since then, it's developed more into a sort of farming town, and it's been a sort of centre of the sort of northern King country farming community.
Within Kuiti and just outside of its reach, there's lots of good spots for fishing, for mountain biking, for hiking. We've also got the Waitomo Cave 15 minutes away. I live in Te Amutu, and that was predominantly a decision made for ease of travel for my husband and I. It means that we can both end up coming home at the end of the day and spend more time together and with our daughter, who's now 18 months old.
I was born in Scotland, moved here when I was 9. I actually was brought up in a town very much the same as Kuiti. It had a river running through it that I started fishing in when I was about the age of 5. So it's quite a similar town to my roots.
I first came to Kuiti as a 6th year medical student as part of my rural GP placement from the University of Auckland. I'd heard good things about it, so I actually asked to come here. And I spent 6 weeks here and really, really loved my time. And even at that time, I knew I would go into the rural sphere for my long-term practice. So I said to Dr. Keith Buswell at the time, you can't retire till I come back and do some of my training here.
Ellie and I are both general practitioners. We moved here 40 years ago, and we initially had a solo general practice that we shared. I came to work in Kuiti primarily because of its location, being able to live in a rural area, but also we have always felt challenged by working in smaller communities where the healthcare that needs to be provided has to be quite comprehensive. The hospital was established 100 years ago, and in fact we've only recently celebrated that 100th anniversary in November last year. In the early 1990s, Kuiti Hospital had been providing a wide range of surgical services and ED services and so forth, but the general practitioners decided to work together to integrate and form a relationship between the medical centre and the hospital. And that integrated model has managed to really stand the test of time and is still the same model that works today.
Kuiti Hospital is a 12-bed inpatient ward with a 2-bed ED and has a full range of services including laboratory, radiology and allied health staffing. We have 9 doctors employed by Kuiti Medical Centre, 4 of whom predominantly work across both the hospital and medical centre, and all 9 doctors are on a rotating schedule for after-hours care. I work across both the medical centre and the hospital. I'm now a practice owner here as well. Often I'll get to see one of my patients in general practice, and if they're unwell, I can easily admit them to Kuiti Hospital, and I get to look after them in hospital, and when they get discharged I know that they're going to have that follow-up again with myself.
My role or my title as charge nurse manager has changed many times over the in excess of 30 years that I have been here. Here at the hospital we have nursing students. Now that's great because we then, as nurses in the rural hospitals, we have the opportunity to inspire these nurses to want to come back to rural nursing. That's really important.
Kuiti is one of the 4 sites for the University of Auckland's Rural Medical Immersion Program, which means that we get 3 fifth-year medical students for the duration of their 5th year, and they're immersed into our community. They live here in Kuiti and they work across both medical centre and hospital for all of their 5th year training.
From the time they come, we like to see them go with at least managing a patient workload and teaching them about how important the communication with the patient and their family or support person is.
Having the Rural Medical Immersion Program students is really vital for us to expose these students to what true rural care looks like, because you cannot get that in an urban setting.
We're in the process of piloting a project under the Rural Urgent Care to incorporate a St John's extended care paramedic into the medical centre. That paramedic is now actually doing the first response to prime. We would, as doctors, be part of that response if it was a high level sort of a response. That is allowing us to work in a more integrated way with St John's. We feel that by the St John's working in the practice, then it's going to really enhance that relationship. It also means that the extended care paramedic can work very closely with us with seeing our patients, and when they're not out on calls, they're actually working in the practice seeing our patients.
This integrated model of care is the future of rural healthcare in New Zealand. It bridges that primary and secondary care divide, and it attracts more of our junior rural doctors for long-term work placements because they can do both general practice and acute medicine or emergency medicines.
Having been here now for 40 years, I mean, that's a relationship that evolves over time, and that is one of the real values of having a long-term connection with the community, because you do get to the point where you feel as though you just about know everybody here, and those interactions are both, you know, professional at work, but they very much extend into the community.
We're like an extended whānau here. Everyone's really close and we kind of celebrate all our highs together, go through lows together and things. It's like working with family when I come to work every day.